Here are the 5 reasons why finding treatment might be difficult for you. Reason 1, limited availability. Look, there are places all over this country where there just isn't any resources, especially for some specialized treatment for like dual diagnosis. Oftentimes people have to look hours away from the area that they live to find a program. And then let's hope that you don't encounter a wait list where you may be forced to wait up to 30, 60 days before you can get in. Reason 2, navigating options. The reality is when you begin this journey of looking for a program that works for you, there's a variety of different options that make it overwhelming and impossible to find a place to start that oftentimes people just give up. And then just not really understanding what those options are. Inpatient, outpatient, medical detox, holistic, the list goes on. Reason 3, financial barriers. Look, this is a part of the industry that's tough, and a lot of people want to act like it isn't one of the biggest barriers, but it is. Look, if you have insurance, then you have to deal with the insurance issues, such as what plan do you have? What types of treatment will they cover? How long will they cover it with? This can be most frustrating for those who are newly coming into recovery. And if you don't have insurance, then you're really limited to working with publicly funded programs or private cash pay programs, which can be really expensive and cost thousands of dollars. Reason 4, stigma and judgment. Unfortunately, a reality that we're still seeing today in 2025 is stigma towards addictions, mental health disorders, and seeking treatment. This could look like internalized guilt and fear that keeps people from actually seeking treatment, or pressure from friends and family to act like nothing's wrong and keep moving on. Reason number 5, taking the leap. Look, there's a huge difference between looking for treatment and then deciding to actually go to treatment. And with that decision comes a lot of fear and anxiety and the unknown of what's going to happen. Look, this is a major life choice to make major changes to one's life, and this decision is not one that comes easy. That's why we say that decision is one that you shouldn't make alone. So if you or someone that you care about is trying to take that leap of faith today, reach out, talk to a professional, someone that can guide you through this process.
Hello, Ava Health.